Hello everyone, welcome to my YouTube channel Nursing Education. My name is Pinky and today I am here with another video of Partograph, and today I will do the Partograph exercise. If you have not subscribed to my channel yet, please subscribe it and press the bell icon to get more video. Here you can see the Partograph case where the patient name, hospital number, age, parity, gravida, gestational age, last menstruation period, expected date of delivery, then date, rupture of membrane, date and time is given, and patient was admitted with the pain on the lower abdomen and drainage of the light cord. Based on the information given about the woman, I have recorded the Partograph, and here you can see that I have recorded the registration number of the woman. So if the hospital is having a registration number, you can write the registration number, or if it is having the hospital number, you can write the hospital number. And then the name of the woman I have written here, the Sunita Shrestha. In the information also Sunita Shrestha is given. The age of the woman is 26 years, so I have recorded age here, 26 years. And then date is 6/2/2022. In the patient information it is given, so based on that I have recorded in the date 6/2/2022. Then parity and gravida. So the woman is pregnant for the first time and she is a G1 primary gravida woman. So here the 1 is written in the gravida, and in the parity I have recorded the 0. And the last menstruation period of the patient is 26/4/2022. So based on this information I have recorded in the LMP 29/4/2022, and the EDD, expected date of delivery of the woman, is 6/2/2022. So based on this information I have recorded in the EDD. And then the gestational age, so today is her expected date of delivery, so based on that her gestational age is 40 weeks of gestation, and also you can calculate from the last menstruation period. So I have recorded gestational age in the gestational 40 weeks of gestation, and the ROM is a rupture of membrane. So you have to write the time or the date of rupture of membrane. So here I have recorded the time 6:30 AM and then date 6/2/2022. Then the labor duration. So after the delivery you need to record the labor duration of first stage and second stage of the labor. Then here I have written the facility or the clinic names, that is maternity hospital. Here you can see the information of the woman, and the examination was done at 9 AM. So this information you can get from the vaginal examination and fetal auscultation as well as from the abdominal palpation. So here you can see the examination time is 9 AM and cervical dilatation of the woman is 4 cm. Membrane is ruptured, liquid is clear, presentation is cephalic, and fetal heart rate is 140 beat per minute. There is no molding, and descent is 3/5, and contraction in 10 minutes is 3 contraction, 2 severe and the 1 moderate. So based on this information I am going to plot in the Partograph. After you have recorded the information of the woman, next you have to record the cervical dilatation, then any information. So at 9 AM, cervical dilatation of the woman was 4 cm. So here you can see in the alert line it is a 4 cm, and you have to plot like this in a cross manner, and then you have to write the time. So here I have written the time 9 AM, and this box is a 1 hour interval, so it is written 9 AM 10 AM. In case if at 9 AM the woman's cervical dilatation was 5 cm, then you have to plot in the 5 here first, and then you have to write 9 AM here, and you have to leave this line. So next we have to plot in the Partograph is a fetal heart rate. So here you can see the fetal heart rate is plotted here 140, as you have seen in the information of the woman that the fetal heart rate was 140. So based on that information it is recorded here. Next component you have to record is the liquid and molding of the head. So it is here liquid and molding. If the membrane is intact you have to write I, and if the membrane is ruptured then you have to see the color of light cord. If it is clear you have to write C, and if it is a contain meconium stain then you have to write M, And then you have to record the molding. So here I have a written 0 because there was no molding, and the bone are separated and the suture can be filled easily during a vaginal examination. So at that time you have to write 0, and if the suture are opposed then you have to write 1. If the suture are overlapped and it is reducible then you have to write 2, and if the sutures are overlapped and it is not reducible you have to write 3 in the molding. Next one is a contraction per 10 minutes. As you have seen in the information of the woman that there was 3 contraction, 2 was severe and the 1 was moderate. So here severe one is shaded completely. This is red color is severe one. 2 severe was there and the 1 was moderate, and here the line is drawn in the moderate contraction. You have to take contraction every 30 minutes and then you have to record in this line. So this box is 30-minute interval. Next one is a descent. So descent you can plot after plotting a cervical dilatation also. So yeah, as you have seen the information of the woman that the descent was 3/5. So here I have plotted. This is a 3 and I have plotted here in the descent. So you have to draw the circle in the descent. You can see here. You can see the information of the vital sign of the woman as well as the oxytocin and the urine output of the woman. So her pulse rate is 90 beat per minute and blood pressure is 120 by 80 mm of Hg. Temperature is 36.8 degrees centigrade and she's on oxytocin, that is a 10 unit per liter, and it is on 20 drops per minute, and the her urine output at 9 am was 100 ml. So this information I am going to plot in the partograph. So as you have seen that woman is on the oxytocin and that is a 10 unit per liter and drop rate is a 20 drops per minute, and you have to take contraction every half an hour, and based on the contraction you have to increase the drops per minute of oxytocin. So at every 30 minutes you have to increase 10 drops per minute until the maximum drops rate is reached. And based on the hospital policy, maximum drops rate might be 40 or 60, but you cannot give 60 drops, more than 60 drops per minute. Now you can plot the patient blood pressure, pulse rate, temperature, and the urine output. So this is a for the blood pressure. Here you can see the arrow. So as the woman blood pressure is 120 by 80, systolic blood pressure is plotted here, and this is a diastolic blood pressure. And her pulse rate is 90 beat per minute, so dot is given here. Here you can see the dot. And temperature is 36.8 degrees centigrade, so it is written here, and the urine output is 100 ml at 9 am, so it is recorded here. You have seen that I have recorded the partograph, and the information I was taken from a vaginal examination which was done at 9 am, and the another vaginal examination is done at the 1 pm. And between the first and second vaginal examination there is a 4-hour interval. The information is cervical dilatation is 8 cm, membrane is ruptured, liquid is clear, presentation is cephalic, fetal heart rate is 130 beat per minute, there is no molding, descent is 0/5, contraction in 10 minutes is 3 severe contraction and 2 moderate contractions. So patient pulse rate is 80 beat per minute, blood pressure is 120 by 70 mm of Hg, and temperature is 36.8 degrees centigrade. She is on oxytocin, that is 10 unit per liter, and the 40 drops per minute. Her urine output at 1 pm is 150 ml. So based on the information of the woman, I have recorded in the partograph. So you can see here the cervical dilatation, as her cervical dilatation was 8 centimeters, so it is plotted here. And the fetal heart rate was 130 beat per minute, so it is plotted here. And the liquid was clear, so it is written C, and there was no molding, so it is written as 0. And descent was 0/5, so it is recorded here. And the both descent of the head is connected together. And the contraction of the woman was 5 contraction was there, 3 was severe and 2 was moderate. and she was in oxytocin 10 unit per liter, so you have to write here, and 40 drops per minute you have to write here. And the blood pressure of the woman was 120 by 70, so this is a systolic blood pressure and this is a diastolic blood pressure. Pulse rate was just 80 beat per minute, so it is recorded here. And temperature was 36.8 degrees centigrade, so it is recorded in this box, and the urine output was 150 ml, so it is recorded here. So like this you have to plot in the partograph. So you have to record fetal heart rate every 30 minutes, and also the contraction every 30 minutes you have to record, and based on that contraction you have to increase the drop of oxytocin and you have to record here. And blood pressure you have to take every 4 hourly and mark with the arrow, and pulse rate you have to take every 30 minutes, temperature every 2 hourly, and the urine output whenever woman passed urine, or if she is on the catheter, so whenever you empty the catheter or the urine bag you have to write in the urine. And if any examination was done of the urine, you can write the information based on the examination. Thank you for watching. Please like, subscribe and press the bell icon to get more video, and please keep supporting.